Hello everyone, I am Shomukant Tigri. Welcome to my channel. In this video, we will discuss most important MCQs on CNS drugs. Okay, so let's start. First question is the minimal alveolar concentration of an inhalation anesthetic is a measure of its. Options are potency, therapeutic index, diffusibility, oil water partition coefficient. So when you are watching this video, please pause the video and answer yourself first. उसके बाद आप explanation देखना, ठीक है? So question is asking about what is minimal alveolar concentration and why it is used. See, minimal alveolar concentration is a measurement method of your potency of inhalation anesthetic. Okay. So GPAT 2015 में भी इस टाइप का क्वेश्चन पूछा था उन्होंने, ठीक है? So what is minimal alveolar concentration? It is the lowest concentration of an inhalation anesthetic in alveoli to produce immobility in 50% individuals. Okay, that is the definition of your minimal alveolar concentration. And greater the MAC value, lesser the potency. That means the relation between the MAC value and potency is inversely proportional. Okay. So greater the MAC value, lesser the potency of inhalation anesthetic, and lesser the potency, greater the MAC value. Okay, and it's accepted as a valid measure of potency of inhalation gas. I hope it is clear to you now. Then coming to the next question, this is very important question and very conceptual question. The mechanism of action of barbiturates differs from that of benzodiazepine in that means the difference between barbiturates and benzodiazepines. What is the difference between barbiturates and benzodiazepines in terms of your mechanism of action? Okay, options are: do not affect GABA benzodiazepine receptor chloride channel complex, act as inverse agonist at the benzodiazepine receptor, increase the frequency of chloride channel opening without affecting its lifetime, have both GABA facilitatory as well as GABA mimetic action. So your answer will be option D. That means benzodiazepines have only GABA facilitatory effect, whereas barbiturates have GABA facilitatory effect plus GABA mimetic effect. What is this? Let's understand. This is the chlorine channel, GABA gated chlorine channel. Okay, and there are some few subunits like this is beta, this is gamma, this is alpha, this is beta, and this is alpha slash beta. Okay, in case of alpha subunit, benzodiazepine can bind in alpha subunit. In case of beta subunit, GABA can bind here. In case of alpha slash beta, barbiturate can bind here. Okay, so in case of benzodiazepine, benzodiazepine can facilitate the binding of GABA in the beta site. Okay, and उसके बाद क्या होगा? That will lead to the opening of the GABA channel. Okay, and that will lead to the cell hyperpolarization. But in case of barbiturate can facilitate GABA binding on the beta site of the receptor, but उनका mimetic action भी है. मतलब barbiturate can mimic GABA. That means if there is no GABA, then barbiturate itself can open this receptor, can open this chlorine channel, and chlorine will enter into the cell, and that will eventually hyperpolarize the cell. Okay, that is the basic difference. What is GABA facilitatory and what is GABA mimetic action? Benzodiazepine has only GABA facilitatory action, whereas barbiturates have GABA facilitatory action as well as GABA mimetic action. That is the main difference. Another important difference is barbiturate can longer the duration of channel opening. Okay, barbiturate can lead to open the channel for longer duration, but whereas benzodiazepine can increase the frequency of the channel opening. These two are major differences between barbiturate and benzodiazepine in terms of your mechanism of action. Okay. So let's come to the next question. Which general anesthetic selectively inhibits excitatory NMDA receptors? That is very important. See, the mechanism of actions of all anesthetic agents, general anesthetic agents, is very important. You have to summarize all of them, okay, and make a table, make a chart. I am giving here the chart and you can take a screenshot. Options are thiopentone, halothane, desflurane, ketamine. See, your answer will be ketamine because ketamine can inhibit the excitatory NMDA receptor. Okay, let's understand the mechanism, different mechanisms of different general anesthetic drugs. Okay, so opening of GABA mediated chlorine channel, this is a type of mechanism that can caused by barbiturates, benzodiazepines and propofol. Okay, opening of glycine gated chlorine channel is caused by barbiturates and propofol. Inhibition of neuronal cation channel का जो inhibition होता है वो होता है that is caused by fluorinated anesthetics and barbiturates. Fluorinated anesthetics mean isoflurane, desflurane. Okay, these are the fluorinated anesthetics. Okay, then inhibition of NM type of glutamate receptor that is caused by N2O and ketamine. This slide is very important. You can take a screenshot and make a note of yourself. Okay, coming to the next question. Which of the following is a sign of deep anesthesia? This is a very straightforward question. Options are appearance of tears in eyes, resistance of passive inflation of lungs, fall in blood pressure, patient makes swallowing movements. Okay, option will be your answer will be your fall in blood pressure is a sign of deep anesthesia. Coming to the next question. The most probable mechanism of anticonvulsant action of phenytoin. Phenytoin जो ड्रग होता है ना एंटीकन्वल्सेंट ड्रग, उसका मेकेनिज्म क्या है? ठीक है, क्वेश्चन इज आस्किंग अबाउट दैट. तो ऑप्शंस आर फैसिलेशन ऑफ गाबार्जिक इनहिबिटरी ट्रांसमिशन, hyperpolarization of neurons, interaction with calcium 2 plus channels to promote calcium 2 plus influx, prolongation of voltage sensitive neuronal sodium channel inactivation. All of you know that phenytoin acts through inhibition of sodium channel. ठीक है, so your answer will be option D. Let's understand the different mechanisms of different anticonvulsant drugs. Okay, how they work. So prolongation of sodium channel inactivation is done by phenytoin, carbamazepine, valproate, lamotrigine, topiramate. These are the lacosamide, jonisamide. These are the drug that can cause sodium channel inactivation, whereas calcium channel inactivation or calcium channel inhibition, especially T type of calcium channel inhibition, is caused by ethosuximide, valproate and jonisamide. See, you can find valproate in three of these following mechanisms. Like valproate can cause sodium channel inactivation, valproate can cause calcium channel inactivation, and valproate also can cause chlorine channel opening. These three are the mechanism of action of valproate. Valproate can act through all of these three mechanisms. Okay, so GABA mediated chlorine channel opening is caused by barbiturate, benzodiazepine, vigabatine, valproate. These are the drug which can cause facilitation of GABA mediated chlorine channel. I hope it is clear to you. Coming to the next question. The preferred drug for suppressing febrile convulsion is, this is very important question. Okay, intramuscular phenobarbital, intravenous phenytoin, rectal diazepam and oral sodium valproate. See, your answer will be rectal diazepam. Okay, why? You have to understand this table, like choice of anti-seizure drugs. Okay, in case of absence seizure, myoclonic seizure and atonic seizure, your drug of choice will be valproate, sodium valproate. Whereas in case of febrile seizure, diazepam in rectal route will be your drug of choice. In case of status epilepticus, lorazepam IV route will be your drug of choice. You have to remember these particular table from KD Tripathi. Okay, this is very important. Then coming to the next question, second gas effect is exerted by which of the following gas when co-administered with halothane? See, options are nitrous oxide, cyclopropane, nitrogen, helium. See, only one candidate is here, that is nitrous oxide. This can cause second gas effect and उसके साथ साथ diffusion hypoxia. These two are caused by your nitrous oxide. Then coming to the next question, I think it is also a very important question. Malignant hyperthermia is a rare complication of which of the following anesthetic? This is very important. Okay, malignant hyperthermia. That means body temperature surprisingly will increase. Okay, options are ketamine, thiopental sodium, halothane, and ether. See, your answer will be halothane. Halothane is a fluorinated anesthetic, inhalation anesthetic, which can cause malignant hyperthermia. Let's understand about halothane in some detail. See, halothane is a volatile liquid with sweet odor. It's non-irritant and non-inflammable. That is the major advantage of halothane. It's non-irritant and non-inflammable. Okay. It is a good anesthetic drug but very poor analgesic action. It does possess very low analgesic action, but it's a good anesthetic drug. Okay. It is stored in amber color bottles. Okay. And halothane can cause your calcium channel inactivation. Okay. And cardiac output after giving halothane, cardiac output is reduced. Cardiac output is reduced and BP also will fall after giving halothane. And it can cause adverse effects, sir. It can cause hepatitis on repeated use, and it can also cause malignant hyperthermia in repeated use. Okay. So these two are the major disadvantages of or major adverse effect of halothane. Okay. I hope it is clear to you. Now I am giving you an assignment. All of you who are watching this video, please do comment the answer of this question in the comment section below. Okay. So as a general anesthetic, halothane has the following advantages except, okay, halothane का बहुत सारे advantage है, कौन सा नहीं है उनका advantage? Options are, it is very good analgesic action, it has very good analgesic action, non-inflammable and non-explosive, reasonably rapid induction of anesthesia, pleasant and non-irritating. I have just discussed the answer. Okay, I hope all of you answered the answer of this question in the comment section below. Coming to the next question, gabapentin acts through. Gabapentin acts as a GABA agonist, as a precursor of GABA by enhancing GABA release and by GABA independent mechanism. So here your answer will be by enhancing GABA release. Gabapentin acts through by enhancing GABA release. That will be your answer. Next, coming to the last question of today's class, dissociative anesthesia is produced by. See, it's a favorite question of mine. Dissociative anesthesia is produced by. I hope all of you know that ketamine will be the answer. Dissociative anesthesia is produced by ketamine. But what is dissociative anesthesia? Dissociative anesthesia means in this anesthetic process, patient appears to be conscious. Patient appears to be conscious. That means it opens his eyes, makes swallowing movements, okay, and it is characterized by profound analgesia, immobility, amnesia with light sleep. That is your dissociative anesthesia, and ketamine is famous for it. Okay, so this is the end of our video. Hope all of you like the video. Please like, share and subscribe our channel. Thank you.